Nearly every county in New Mexico is facing a shortage of health providers, and that's likely to get even worse because there will be 160,000 new Medicaid patients beginning this year in New Mexico, and there'll be thousands more using coverage under the Affordable Care Act. Now, Governor Susana Martinez has proposed several strategies to address this in her budget. That includes expanding the number of community health workers, adding more slots for primary care physicians, and perhaps most importantly, nurse practitioners at the UNM Health Sciences Center, and graduating more nurses. Now, Diane, this is your field, and there's a fundamental question here about losing these doctors. Is this just going to be a Band-Aid in your view, what the governor is proposing, or is something vastly deeper going on here as to either why doctors leave or don't come here? Is that the solution, what the governor is proposing?
I believe it's a Band-Aid. I think it's a first step. We do need more slots, and that takes funding.
Yeah.
But the thing that, statistic that bothers me the most is nationally, over 60% of residents stay in practice within 20 miles of where they did their residency. In New Mexico, we keep 1.2 residents out of every 4 in New Mexico. So there's a big...
Is there I'm sorry to cut you off there.
No,
that's an interesting statistic. Is there some study on why that is? Why was that number so low?
I don't know.
Yeah.
We're looking at that. We're looking at ways, and some of the things that I think we have to change our whole fundamental attitude about physicians and healthcare providers. We have to treat them like they're of value.
Gotcha.
The community has to be involved, and our organization, as well as several others, have been working. UNM's doing a great job on recruiting, but they're recruiting into a hospital environment. Unfortunately, we don't have a physician in Daddle.
Right.
And my concern then, when you talk about these expansions, is our goal is to get more healthcare providers in rural areas.
Right.
What's going to take them there?
Right.
What's going to keep them there?
And on that note, Tony, just a little short time. We have tried things in the past like extra pay, mixed results, that kind of thing. You never know. But one of the questions I have is, our doctor corps as it stands now, the average age is the highest in the nation.
Yeah.
It's amazing to me. So starting literally next year is the reporting we were reading, we're going to have this exodus of doctors. Does that not denote a panic moment here? Oh, so we need to do something.
Absolutely. As if moving over to the healthcare and having trying to attract more people into a system that is already overloaded should have set off the red flags right away. But yeah, hopefully it's a key part to economic development. It's just a key part to living in New Mexico.
Right.
And so hopefully somebody will take the leadership position and say, okay, we have a short-term Band-Aid, but we need a long-term fix.
Right. Sophie, part of this issue that's so interesting to me is you think about specialists. You don't need a specialist, you need a specialist. And so you don't think about it. Needing a neurosurgeon, who thinks about this every day? But once that happens, that's a very serious problem, to have just one of certain types across the entire state of New Mexico.
And we are unusual, not unusual I think for the West, but when you compare to some parts of the country, much of New Mexico is used to this idea of, where's my nearest specialist? Am I going to have to go to Colorado Springs or to Denver? Am I going to have to go out to Phoenix? Am I going to have to go? Because for parts of the state, that might be easier than getting to Albuquerque.
That's right.
But we have these hubs right now for specialists, and then we hope to get general practice out in the rest of the state. One thing that I think is important to note for those who are watching at home, for those who are just directing their attention to this now, these demographic trends, these issues, we have known about them for some time. We've been tracking about them and trying to bring attention to them for some time. And so, yes, it is pressing, but it is important to note the fact that people will be getting health care now is not the cause of the problem. The demographic shifts have been coming for some time. People were born 60 years ago who are retiring now.
Yeah, I'm close to that. Don't say it with that tone of voice,
So no,
I'm in single digits till then.
Know that solutions are long-term solutions, not just short-term solutions. The same way this is a long-term.
Speaking of solutions, Javier Benavides, it's interesting. We are on trend with the rest of the country by using so-called mid-level practitioners, nurse practitioners, people that can do about 80–90% of what a physician can do. Is that the answer? Not that, quite that much. Thank you for saying that. I've never believed that percentage as well. Is that the solution here? Or is that, again, stopgap? Where do we go here?
Yeah, I think this is a very transformative change for our country and for our state. But it's like Sophie was saying, less reactive. Hopefully, I mean, it's market-based, so hopefully we'll start to see the market respond and see a lot more people entering into the medical field. But
When you say market response, are we not paying our folks enough, or is it not enticing enough to?
I can't remember if it was Tom or Diane that said it, but yeah, I think doctors should be recognized as heroes and an important part of each of our communities.
Yeah, because money's not everything. I don't care what the
No,
profession
but
is. So
we've got the lowest reimbursement rates on Medicare and Medicaid than any of our neighboring states.
Right.
I mean, it's an issue. And what is happening is physicians are limiting the number of those patients that they will take.
And that's not a good recipe for New Mexico.
That is not a good recipe